Next, avoiding fraud and abuse. Introduction. Preventing fraud and abuse is essential to maintaining the integrity of healthcare billing and coding. This module provides an overview of the legal and ethical responsibilities to avoid unethical practices, protect patient trust, and ensure compliance with laws like the False Claims Act and anti-kickback statute. Understanding fraud and abuse. Fraud, intentionally submitting false or misleading information to secure improper payments. Examples include falsifying diagnosis or procedures. Next, abuse. Practices that are inconsistent with accepted medical or billing standards, leading to overpayment or unnecessary services. Examples include upcoding or unbundling services. Next, legal frameworks and regulations. Firstly, the False Claims Act. It penalizes submitting claims with false or fraudulent information. Next, anti-kickback statute. It prohibits offering or soliciting kickbacks for referrals or services. Next, Stark Law. It prevents a physician from referring patients for designated health services to entities with which they have a financial relationship, unless exceptions apply. Next, HIPAA privacy and security rules. It protects patient data from misuse. Next, common types of fraud and abuse. Falsifying documentation. It is for fake procedures or diagnosis. Upcoding, such as billing for more complex or costly services than provided. Unbundling, it includes separately billing procedures that should be billed as a single service. Next, kickbacks and bribery, providing or accepting incentives for referrals. Next, duplicate billing, submitting multiple claims for the same service. Next, risk and consequences. These include legal penalties such as fines, imprisonment, or exclusions from federal healthcare programs. Next, financial loss, repayment of improper payments and penalties. Next, reputational damage, such as loss of trust among patients and industry peers. Next, operational disruptions. This include audits, investigations, and sanctions. Next, best practices to for preventing fraud and abuse. Firstly, ensuring accurate documentation. Record truthful, complete, and supported information. Next, following coding guidelines. Use codes correctly without upcoding or unbundling. Next, avoiding conflicts of interest. Do not accept incentives influencing coding or billing. Next, conduct regular audits. Review claims and documentation to detect errors or suspicious activity. Next, educate staff by providing ongoing training on legal, ethical, and compliance standards. Next, response to suspected violations. Report concerns. Use internal channels or compliance officers to report concerns. Next, investigate. Review related documentation and claims thoroughly for any violations. Next, correct errors. Fix mistakes and take corrective actions. Cooperate. Fully participate in any investigations or audits. In summary, upholding ethical standards and adhering to laws protecting both patient and organizations from legal and financial risks. Vigilance, accurate documentation, and ongoing compliance trainings are vital to avoiding fraudulent practices and maintaining trust. Thank you.